This patient almost suffering with class 5A Norwood's classification baldness. We are planning 2 sessions for this patient. 2 sessions in the sense 2 times a transplant, that's micro FUE. After first session, second session is supposed to be minimum gap of 6 months, maximum would be any time. So why we are planning 2 sessions for this patient is it's because of the class 5A baldness, that is a large scalp. Irrespective of the baldness classification, he has large size of the scalp which needs more grafts. Number two, a very fair skin, again skin and hair contrast will not match, so we need more grafts. Number three, tough skin. A tough skin means probably a difficulty we'll face in while extraction, so there's a tough skin. And last one is average donor. The donor is not that great. One more important thing after a transplant is how to prevent swelling. We do come across most of the patients will ask me, do I get swelling? Because I'm sure swelling will happen, but how do you manage it? How do you prevent swelling is most important. So most of the patients had an experience in different places, come across and shown me few pics saying that I got my eyes swollen, nose swollen. I'm sure this can be preventable 98 to 99%. How do we prevent this swelling? And there is a kind of a few protocols your surgeon know. During the surgery, what kind of medicines should be given? That's the most important prior to the surgery. And second thing is, patient's supposed to have a best rest, good rest before the transplantation procedure. And even while doing the procedure also, surgeon should not unnecessarily inject normal saline to the scalp in the frontal area. That also can prevent your swelling. And most importantly, at our clinic, we practice few methods to reduce swelling is, we're going to give the bandage first of all, and this bandage is removed next day after 24 hours. After removal of this bandage, we are going to give a ribbon kind of bandage which covers on the forehead. This will avoid 98% of the swelling because of gravity. And other point is instructions like you should not sleep on face down position, upside down you should not sleep. You can sleep back or right side, I mean left side or right side, whatever it is, okay. When you sleep on face down position, because of gravity, all the normal saline which is injected can come to the periorbital area around the eyes because there is a loose space here. So that's the idea of giving the ribbon bandage. Not only ribbon bandage, there are the other techniques, other methods how we prevent the swelling. We practice that at our clinic. We rarely see any swelling, and that's the most important step. And this patient had a very clear and good, he maintained very well. 13th day we rub and wash the grafts. Again, I'm telling you, we have to rub and wash the grafts. That's the reason we call the patient here to prevent what do you say, a lot of dead cells and scabs on the scalp are there. If you don't wash it, probably there's a chance of getting infection. To prevent any infection, we call them on 13th day. You can see this patient how nicely he's looking at it. You can touch the backside donor as well as the front side area also. So this is 13th day wash we're given at the clinic. Of course, you can do at your home also. Well, after 45 days, how do you prevent this shock loss? How do you enhance the donor area? How do you enhance the growth rate? So we would call patient for bio-PRP around the 45th day. That's what this patient we are given today, bio-PRP, to enhance the donor. By now already, because of the medicines what we are given, the donor is already looking better and completely healed, and even the scalp looks very clean in the implanted area. That's what that means. This patient's scalp is very clean. That means I'm sure we're going to achieve best results. This is a 4th month follow-up of this patient. I can see, we can observe the donor is greatly improved, and the implanted area also, the sprouting out new hairs. And this is just because of the PRP what we given, the bio-PRP and few multivitamin therapy. You can see there is no folliculitis infection, there is no other sort of infections. He kept the scalp is very clean, and most of the things here you notice that new hairs are growing, and that's very enthusiastic and kind of very interesting to see sprouting out new hair. And the backside the donor quality is very much improved, and you can see there is no gaps in the donor looks absolutely normal. That's called something donor management. How do you maintain the existing hair? That's an important question comes in the mind after the transplantation. This patient, we followed that protocol too. We have given him multivitamin therapy and even the PRP to maintain existing hair and as well as the shock loss and to enhance the weak hair whatever he had before consultation. So this is a very important step in after the transplantation. So hair fall has to be controlled by managing a good diet, good multivitamin therapy, and bio-PRP also. This patient now we are planning second session after 3 years. Of course, patient didn't get time to come back to second session after 8 months, and now we are planning. This is a 3 years later second session we are planning. Why we supposed to plan a second session after minimum gap 8 months? Because your doctor will get a chance to understand whichever the area we need to correct, whichever the area you need to get more density, and that is the reason we do a plan second session after 8 months rather doing it immediately. So if you do immediately first day, second day, third day, probably your surgeon lose a chance, lose idea, lose a chance that he cannot correct it. So now this patient, we understood there is a density, he needs it in a crown area, as we already discussed during the first time that he would need second session for the crown area. Now, what we did not expect is the frontal area also density is going thin. That area we are going to implant now, and I am going to extend little a centimeter down natural hairline. So these are the things I am getting a chance to correct it in during second session. And now this is almost 8 months after second session. That means total for the first surgery almost 3 years 8 months. Now we achieved final results. The more important points or highlights in this patient is very natural density. You can see a very natural it is, and natural hairline, and excellent donor management. No one even understand after 2 times of harvestation that we have done harvestation.